Hello, everyone. So, we want to understand if there is any correlation of our emotions and does that culminate into a chronic condition? Very, very important. So, that's what we're going to talk to Dr. Kim. Dr. Kim is a doctor of Oriental Medicine joining me live. Thank you so much, Dr. Kim, for joining me.
Hello, hi, nice to meet you, and thank you for this opportunity so I can share a little bit about my experience and expertise. I'm very happy to be here.
All right. So let's just understand, when we talk about the emotional health, I mean, there could be it's such a wide variety, right? Someone could have gone through a trauma when they were a kid or lost someone or going through some kind of a issues, right? So what
Yeah.
have you seen in your practice? Let's just talk about your experience, that correlation of that with the chronic condition.
So one of the very common emotion that I see come up and how it directly affects a physical health is grief. I see a lot of patients that have grief that are not dealt with, and it shows up as an upper respiratory type of condition. It could be coughing, upper respiratory infection, wheezing, asthma. So I'm seeing that type of correlation. Another one I see a lot is anger, repressed anger showing up as thyroid condition or liver condition. And a very common one is depression. Depression shows up in pretty across the board with any type of chronic disease.
Okay. And then let's just talk, what does the research say about this?
So there's a lot of research that has been done throughout the years. For example, there's a Jane Turner and Brian Kelly that talk about emotional dimension of chronic diseases. Um, and there has been research done about common psychological factors in chronic diseases as well. And they would talk about cardiovascular disease, diabetes, asthma, arthritis, osteoporosis, and how those are complicated later on by emotional or psychiatric symptoms. Um, there has also been research done about the intersection of mental health and chronic disease by Grace Fernandez and John Hopkins. So there's quite a lot of research that has been done in the last 50 years in which in the medical field, we're realizing it's not the mind and the body separate. It's actually the mind and the body is a whole. So how we're doing emotionally, psychologically has an impact in our physical body and vice versa. If we're not doing well physically, for example, let's say our digestive system is not good and we're not able to absorb nutrients such as calcium or potassium, we're more prone to have um, um, depression, for example, or the brain chemistry is off because we're not getting the nutrients or malnutrition or eating poorly or overindulging. For example, we have seen research of children with hyperactivity is tied to their diet, such as too much sugar or processed food. So both of them is connected. It's not just, oh, a behavior is separate from the physical or the physical is separate from the emotion. It's actually tied to each other. We are, as humans, we are a whole. We're not just our mind or our body or or our thoughts. Like we are all of us all together.
Yeah, no, that's so true. And then earlier, we've always compartmentalized our bodies, right? I mean, if you think
Mm-hmm.
about it, 20 years back or even a few years back, we always thought, okay,
Yes.
I need to look at the exercise, at the diet, and not really understanding to your point. So now, being an Oriental medicine doctor, you have a
Mm-hmm.
huge toolbox, right? And it's
Yes.
amazing, amazing. So what are the different type of therapies that you have used? And this is not a medical advice, a big disclaimer, to help your
Mm-hmm.
clients come out of this emotional trauma that you talked about.
So Oriental medicine, like I said, it sees the human being as a whole. They're not just the body or the emotion or the organ system. I tend to look at the patient to see what is going on, what part of their body is out of alignment, and based on that, I will pick the tool. Some of the tool, for example, I have is acupuncture, I have herbal medicine, I have nutrition, food therapy, I have lifestyle therapy, I have breathing, breath work, meditation, I have exercise, stretching. So there's different type of modality depending on what the patient is presenting with and how can I help them get better. And at the end have the optimal health they want. And since I am in the state of Florida, I'm also considered primary care physician. A lot of the time, I also use Western medicine to aid me in this, such as having them do blood work, imaging, so I can compare physiologically what's going on and combine it with a more natural approach. Because a lot of my patients, they're tired of taking a lot of medication that might not be taking care of their problem, but just masking the symptoms. So I take a look at the whole. What else is going on in their body? How can we complement every single aspect of their lives so there's a balance and through that health, overall well-being.
Okay, so maybe you can talk to us just to give some kind of an example, a small example of someone you treated, what it entailed. You talked a lot about acupuncture, herbs, and all that.
Mm-hmm.
So maybe just give
Yeah.
us a brief example to help our viewers, what to look for. What is it that they have to do? Simple tips or simple things that you have used.
So usually patient comes and tell me they've been suffering something that pretty much everyone's suffering right now. Let's say stress, for example, is a very common one. And we are going on 2 years of pandemic, we're having long periods of time of stress, which leads to anxiety or depression. So patients come with this, I ask them, what are some of the symptoms they're getting? Is it overthinking? Is it problem with sleep? Is it digestive issues? Is it feeling tension in their body? And based on that, after the diagnosis and they tell me what are some of the symptoms they have, then I can choose, do we do acupuncture to regulate your nervous system? Do we do herbal medicine to help with your brain chemistry? Do we do lifestyle changes and food changes so that you can get the nutrients you need in order to produce the right brain chemistry? Is it that you've been working indoors for the last 2 years because of the pandemic? Okay, maybe we need to add some movement, promote your circulation, get some sun. Maybe you're deficient in vitamin D from working indoors for so long. So, we schedule in maybe 10 minutes of sun every 3 or 4 hours, so it depends on what it is that's going on that they're showing me. Then I prescribe different things. A lot of time I do all of them. Because a lot of times they need a little bit of everything. They need acupuncture, they need some herbal medicine, they need guidelines of food, what to eat, what not to eat to help their condition. Sometimes I even have patients on a schedule, like, okay, I need you to be in bed before 11 o'clock. I need you to wake up at 7 in the morning. What are the times for you to eat? Based on, from Chinese medicine, we have the circadian rhythm in which every organ system has a very specific 2-hour time, which is the optimal time to do certain type of activity. So I also give them that guideline because unfortunately, in our society, we're so busy, we don't listen to our bodies anymore. We don't listen to the sign, and we just work, and just run as a machine, and we're not paying attention anymore. So part of what I do is also bringing awareness of what is our body trying to tell us? Why are we having the symptoms? A lot of the time, for example, not feeling well or depression could just be that you are not in alignment. Your life is not in alignment with who you are as a person. What is it that makes you happy? When was the last time you smiled? When was the last time you laughed, right? So things as simple as that. Or even something like, when was the last time you had a glass of water? Or when was the last time you were able to eat a proper meal, not in front of the computer checking emails or being rushing through one meeting to another? Like very basic things that we as human beings are forgetting because of the lifestyle that we are used to in order to perform, which is not, we're not meant to live like this. And that's also leading to mental health problems and physical health problems as well.
Okay, so what would be, how should people start with? Like, should they start with, how should they start with? What are the stepping stones, or what are the simple steps that we can all take? Like, you've talked about so many things, but let's just disseminate.
I would say let's go back to basic. How many hours of sleep are you getting per night? Are you getting 6 hours of uninterrupted sleep? How much water are you drinking per day? Are you getting at least half of your body weight in ounces, or about 8 glasses minimum of water, for example? How much movement are you having throughout the day? Are you walking at least 10 minutes, 15 minutes, 20 minutes? These are very, very simple. We're going back to basics, just basic human needs. You think about a baby, what does a baby need? Baby need to eat, baby need to sleep, baby need to move, right? So go back to that. What are we doing for ourselves on a day-to-day basis, right? Basic stuff. Let's get at least 6 hours of sleep, minimum. Let's get 8 glasses of water. right? Let's make sure we have at least 3 meals on a specific time of the day and not rushing through it. One tip that I'll give for free, every single meal should have at least 5 different colors. Not a lot of us are doing that. Instead of thinking, did I have carb? Did I have protein? Did I have vegetables? No, think about 5 different colors. They have to be not the same shades of 5 different color. But for example, I tend to say eat the rainbow, right? The colors of the rainbow, pick 5 of those. If you have 5 different colors in one plate of meal, it's a little bit more balanced. So these are very simple things that I would suggest for people to do. Even getting 10 minutes of sun per day. So many people are not getting, especially those that are living in cold weather where maybe it's snowing and they have to be inside. When was the last time you got at least 10 minutes of sun? So that's something that I would definitely recommend people to do. Very, very simple. Everybody can definitely do that.
Any herbs? And I have to ask you this question since you're a doctor of Oriental Medicine. I personally love herbs, but any herbs, simple common herbs?
I think in general, 90% of the population should be okay with ginger. Ginger as a tea would help with digestion. Digestion is so important. Ginger or peppermint, as long as you're not allergic to it, I'll say make it as a tea. People that live in the north, as long as they're not having any high blood pressure condition, I would say cinnamon tea would be good, help promote the circulation. If the blood is flowing, in general, we feel better. So these are very simple food that is also herb that we can use. And you can get it at any grocery store. You don't have to worry about, oh, do I need to go to an herbal store or whatnot? You can get these in the normal groceries.
Okay, well, thank you so much. The intention was to understand the correlation of our emotional health, right, with the
Yes.
chronic conditions, and we obviously want to prevent that. So it's better to take care of our emotions or
Yes.
now with all the simple tips that Dr. Kim is talking about. And acupuncture is great, like you just talked about, for everything, and Chinese medicine. So is Chinese medicine, other herbs, and all the other things you talked about. Anything else? Any last minute things before I wrap up today?
I would say I would recommend everybody to take at least 20 minutes per day for themselves to do something that they enjoy. No phone, no children, no spouses, no work. 20 minutes just for them to do something they really love. That's my recommendation to everybody that's listening in.
That's a hard one to get, but I think we should all try a few minutes.
Yes, definitely.
Yeah.
Worth a try.
Thank you again,
You're
Dr. Kim,
welcome.
with us. Thank you everyone for supporting us. Stay tuned. We're launching a lot of workshops. Thank you. Bye.